Chapter 20, Assessment of Visual and Auditory Systems. Nursing assessment of visual system. The visual system consists of the external tissues and structures around the eye, also the internal structures of the eye, such as the refractive media, which would be the lens, and the visual pathway in the brain. The entire visual system is important for visual function. The part that you can see with your naked eye and the part that would need more advanced testing to determine. Okay, so again, we have the external structures that surround the eye, the bone, the eyebrows, eyelashes, the tearing system or the lacrimal system, conjunctiva, and sclera. These things all have a role to play in the health of the eye. The cornea and extraocular muscles play an important role in vision. Light reflected from an object in the field of vision passes through the lens and other transparent structures of the eye, and in so doing is refracted, which means bent, so that a clear image can fall on the retina. And then from the retina, the visual image travels through the visual pathway to the occipital cortex, and they are translated as an image. Okay, so some structures and function of vision. The eyeball, we've got 3 layers: sclera, cornea, uveal tract, and retina. Here's a diagram of the various parts of the eye. You may remember this from anatomy. Structures and functions of vision. For light to reach the retina, I mentioned earlier that it has to pass through some structures first: the cornea, aqueous humor, lens, and vitreous. These structures have to remain clear in order for light to reach the retina and stimulate the photoreceptor cells. The transparent cornea is responsible for a lot of the light reflection or refraction necessary for clear vision. The aqueous humor bathes and nourishes the lens. If there's too much aqueous humor being produced, or if there's some type of a blockage in the outflow, it can cause increased pressure within the eye, or intraocular pressure. And this is what we have in glaucoma. We have increased pressure. The lens is a biconvex structure located behind the iris. And also the primary function of the lens is to bend light rays so that they fall onto the retina. An intraocular lens, or the abbreviation is IOL, is a small artificial lens for the eye, and it is a replacement for the eye's natural lens that is removed during cataract surgery. There is also other reasons for replacing a lens, but this is one of them. Again, structures and functions of vision. Refractive errors, there's many different types of refractive error. Remember, we talked about refraction, the ability of the eye to bend light so that they fall on the retina. But if that's not happening correctly, we've got a refractive error. And there's different types of those. Myopia would be nearsightedness. Hyperopia is farsightedness. An astigmatism is where the cornea has an uneven curve, and that can distort vision. Presbyopia is a loss of accommodation, which makes it difficult to focus on close objects. And that's a normal part of aging, typically after the age of 40. So here we have the visual pathway of the image or refractive image. Once the image travels through the refractive media, it is focused on the retina. And then from the retina, the impulses travel through the optic nerve to the optic chiasm, where nasal fibers of each eye cross over to the other side. Fibers from the left field of both eyes form the left optic tract and travel to the left occipital cortex. The fibers from the right field of both eyes form the right optic tract and travel to the right occipital cortex. So this allows determination of the anatomic location of abnormalities, like the occiput of the head. If there is an injury, like say a severe blow to the back of the head, this kind of gives you an idea of why that could affect vision. Breaking down the external structures, those that we can easily see, the eyebrows, eyelids, and lashes. Obviously, they provide protection for the eye, as in the form of a physical barrier to protect the eye from dust, dirt. The brow protrudes over the eye, which forms a bony structure also for protection. Breaking it down a little bit further, the eyelids open by the action of cranial nerve 3, which is the oculomotor nerve, and they close through the action of cranial nerve 7, the facial nerve. The conjunctiva is a transparent mucous membrane that covers the inner surfaces of the eyelids and extends over the sclera, forming a pocket under each eyelid. Glands in the conjunctiva secrete mucus and tears. Blinking of the upper eyelid distributes the tears over the eyeball and nourishes the surface. The sclera is commonly referred to as the white of the eye, and it forms a tough shell, and it helps to protect structures within the eye. Here's a diagram of the glands and how they connect to the nasolacrimal duct. So when you have tearing, your nose is going to run. If you have a severe bloody nose, you may have blood that actually comes up in your eye through that because of the nasolacrimal duct. The iris produces the color of the eye, and then the small round black opening is, of course, the pupil. It is through the pupil that light enters the eye, and it dilates and constricts with two muscles controlled by cranial nerves 5 and 3. 5 is the trigeminal nerve, and 3 is the oculomotor nerve. So more on the internal structures. We said that the lens bends light so that it can focus on the retina, and the ciliary body surrounds the lens and contracts to change the shape of the lens. Another component of the ciliary body is the ciliary processes, and they lie behind the peripheral part of the iris, and they secrete the aqueous humor. The retina is the innermost layer of the eye. It's made up mainly of neurons, and it has these specialized nerve cells or neurons that are responsible for color vision and translating visual images into stimuli that the brain can understand. The retina is made up of rods and cones. The rods provide vision in dim light. Cones are receptive to color and bright light. The macula is the central visual field, and we have very commonly see macular degeneration in the elderly. It is a huge cause of blindness. There are two types of macular degeneration, the wet and the dry. Dry being more common, and the wet being the more severe form, but less common. There are various effects of aging on the visual system. Some of these changes are benign, but others can lead to serious loss of vision. And poor vision can have a significant psychosocial impact on patients. When we're assessing eyes, when we have our pen light, we want to make sure that the light in the room is dim enough to allow for pupillary reactions. And remember that the acronym that we use, PERLA, stands for pupils equal, round, reactive to light, and accommodation. And if all the findings are normal, we can just use this abbreviation in the chart. However, many people miss accurate assessment of accommodation. Accommodation is where you hold your finger about 18 inches from the patient's eyes, have them focus on your finger, and as you bring it close to their nose, they're supposed to follow it with their eyes, and you'll notice their eyes constrict, or their pupils constrict as it gets closer. That is accommodation. So some subjective data that's important to ask your patient, of course, past health history. You want to know if there are any issues going on with their eyes. Do they have cataracts? Have they had, a lens implant, history of glaucoma, or family history of glaucoma? Medications can have an effect on the development of glaucoma and cataracts. Medications can also affect the eyes by causing dryness, by causing dilation or constriction of the pupil. So it's important to know what kind of medications, whether they're prescription or over-the-counter or herbal, different things have an effect on the eyes. So it's important to get that information from your patient when you are doing your assessment. Something else on cardiac issues, certain types of eye drops, particularly the ones used for glaucoma, contain beta blockers and can actually reduce blood pressure. So if they're also taking beta blockers in another form, it's important to know. So again, getting that medication history, and find out if they've had stroke history, surgery, brain surgery, laser treatments on the eyes. Those are all things that may have an effect. Some more subjective data would be the patient's perception of their vision and their ability to perform self-care. You may not know right off hand or right off the bat when you meet a new patient if they're having a vision difficulty or not, but sometimes if you ask them to read something, or if you set their plate of food in front of them and they'll ask you, what the things are on the plate, there can be clues like that that indicate that the patient does have vision impairment. You need to make sure that that gets documented and physicians aware, and you're passing that on in a report so that we can ensure these patients get the care that they need. Of course, we're also going to assess safety in the home. If we discover the patient has a visual impairment, we have to have that determination made as to whether or not they're safe in the home. Do they need special implements like bars, rails, different things in the home to help them to function safely, allergies to medications, and again, going back to your initial assessment about glaucoma in the family or other genetic type of diseases and visual problems. Here's just another list of some other subjective types of data that may be evaluated on your patient. As far as nutritional, metabolic, vitamin C, E, and beta carotene are very important for the eyes, especially for age-related macular degeneration. Of course, if the patient waits until they have it, it's probably not going to correct it, but it can help to postpone or eliminate the effects of macular degeneration. Elimination patterns. The reason this is here is because straining, like when you're performing the Valsalva maneuver in straining, if a patient is having a hard stool or constipation, that can cause increased eye pressure. So if the patient